Multiple sclerosis is an autoimmune condition that affects the central nervous system. That's the nerves basically in your brain and spinal cord, and also your optic nerve. So the cause of MS is unknown, but there might be some environmental and genetic factors involved. So while we don't know the cause of MS, it isn't a contagious condition. No, people are mainly diagnosed between the ages of 20 and 40. However, children can be diagnosed, as can people over the age of 65.
Some of the early symptoms of MS are sensory problems, which might include numbness or tingling, some stumbling when you're walking, fatigue, or some visual problems. MS symptoms vary widely, so other conditions may have some of the same symptoms. However, today the diagnosis process is very thorough. Symptoms of MS can vary widely. Some of the most common ones are fatigue, balance and mobility problems, stiffness and muscle spasms, memory and thinking problems, as well as bladder and bowel problems. MS lesions are damage or scarring which occur to the brain and the spinal cord. This would depend where the lesions are identified on an MRI scan. Some people with MS do have nerve pain. They often describe it as a stabbing pain, a burning pain, or a throbbing pain. Some patients with MS do have seizures, but this is not a common problem. Some patients with MS can have speech problems. They may have some word-finding problems or some slurred speech.
MS is diagnosed by taking a clinical history, neurological examination, carrying out lumbar punctures, MRI scans, and occasionally tests called evoked potentials. MS cannot be diagnosed through a blood test. An MS flare-up is a relapse. A relapse of your multiple sclerosis would be a period of time when your conditions, previous conditions or new conditions have re-emerged or have emerged, and they've been sustained for more than 48 hours in the absence of infection. Flare-ups or relapses can last for any length of time, and because MS is such an individual condition, these periods can be anything from a couple of days to weeks or months. MS progression is very individual, and no two people with MS will have the same progression or speed of progression. So MS is generally categorised as relapsing remitting MS, which is the most common form of MS, secondary progressive MS, and primary progressive MS. Having a long-term progressive condition like multiple sclerosis can lead to other problems further along the line. However, with careful symptom management, these problems can be overcome. MS in itself will not directly kill you. However, some people with very severe disability can go on to have complications arising from their MS.
MS is not hereditary. However, there is a slight increased risk if you have family members with MS. While there's no clinical evidence of this, most of our patients feel that when they are stressed, their symptoms are worse. MS
does not have a cure. However, there are drugs available that can modify the progression of the disease. So some people will be prescribed disease-modifying drugs. The aim of these drugs is to reduce relapse rate and slow down disease progression. There are other drugs available to help you manage the symptoms that you may be having. It's generally recommended that you do not exclude any food groups from your diet and that you try to eat a healthy Mediterranean-type diet. Exercise and keeping fit is important, and also if you smoke, stop smoking.
In the UK, you will need to be referred to a neurologist to make the diagnosis of MS. The law states your employer may need to make some reasonable adjustments to allow you to stay in work. Yes, you can still drive after an MS diagnosis, but you'll need to inform the DVLA and your insurance company. Your ability to get pregnant and have a baby is not affected by MS. It's a good idea to make some notes in preparation for your appointment, things that you want to discuss with your MS nurse. If you have any questions or concerns, speak to your MS nurse or GP. There are lots of really helpful resources and we've put them in the description box below.